All right, good afternoon, everybody. Thank you for joining us today here at the McMaster Health Forum at McMaster University in Hamilton, Ontario. And our guest speaker is actually joining us remotely from Toronto. So this is our first Kiwi Scholar presentation of the fall 2017 term, and there'll be many more to come. For today's presentation, I'm just going to very briefly talk to you about the McMaster Health Forum and to talk to you about our Queen Elizabeth Scholarship Program, and then I'm going to introduce you to our guest speaker today, our outgoing intern, Malcolm Hartman. So the McMaster Health Forum is the leading hub for improving health outcomes through collective problem solving. We aim to harness information, convene stakeholders, and prepare action-oriented leaders to be an agent of change by empowering stakeholders. The Queen Elizabeth Scholarship Program, it is run by a partnership between the Rita Hall Foundation, Community Foundations of Canada, Universities Canada, and Canadian universities. The purpose of the program is to activate a dynamic community of young global leaders across the Commonwealth to create lasting impacts both at home and abroad through cross-cultural exchanges encompassing international education, discovery and inquiry, and professional experiences. Here at the forum, our version of the QES program is strengthening health systems. Our scholars contribute to strengthening health systems and become part of our large and growing network of health system leaders. We are now in our third year of this Kiwi Scholar program. Our first cohort, which went away primarily in 2016, comprised of 8 interns, 2 outbound scholars, and 3 incoming scholars. And our second cohort, of which Malcolm is one, comprised 20 outgoing interns, 1 outgoing scholar, and 1 incoming scholar. We currently have 4 students abroad at the time of this webinar. Our presentation today is due by Malcolm Hartman. At the time of his internship, Malcolm was here at McMaster in the BHSC undergraduate program. He was also a McMaster Health Forum Fellow, and he contributed to the forum initiatives, including synthesizing evidence for evidence briefs, rapid responses, and the evaluation of the Citizen Panel program. His internship goal was to further his understanding of how research evidence is translated to policy decisions. Malcolm is now at the University of Toronto's MD program, and he's joining us today from Toronto. Welcome and enjoy.
Great, thanks James, and hello to everyone at the forum and online. So I'm going to be talking about my time at the Department of Planning, Monitoring and Evaluations. That's in South Africa, in Pretoria, South Africa. And I was there this summer from May to just early August, so 3 months. So I'll just go over some context of the work and then touch on one of the projects, the main project that I was working on, and then some of the takeaways from a QES trip. So just to give some perspective on South Africa as a country, so I guess even before this, it'd be helpful to know that the Department of Planning, Monitoring and Evaluations is a national department. So all of this context is going to be at national level. So South Africa has quite a large population, bigger than Canada, and when you see a map of it, in a land mass is much smaller, so it's quite densely populated. If we look at the GDP of South Africa, it's in the lower end of other OECD countries. So this is from the OECD data from 2016. So the US per capita in South Africa was 13,229, whereas that's the red bar. The black bar is the OECD total for 2016, which was about 42,000. And you can see Canada just to the right of that black bar. We are about 44,000. So hopefully that gives you a bit of an idea about the economic situation there. I have a bit more. So comparing South Africa within Africa and against some other countries is also helpful to get an idea of their economic situation. So they are, compared to countries within Africa, their GDP per capita is quite high. So you can see the size of the bubbles represent GDP per capita. This is from 2010 data, so numbers are a bit different than the OECD data that I just showed. So in 2010, South Africa GDP per capita was about $7,500. You can even just see by the size of the bubbles, it's they are on the upper end for the countries within Africa, which are in blue. It's about comparable to Brazil, which is highlighted here, the green bubble, which is about $1,100 per capita. And the World Bank actually classifies South Africa as an upper to middle income economy or a newly industrialized country. So one of the challenges that a lot of my work, or the work that I was involved in, focused around is spurred by income inequality. So this is the Gini coefficients for all the OECD countries. You can see South Africa is at the far right end, highlighted in red. So it's just a measure of equality or inequality. So 1 being totally unequal, 0 being completely equal. And it's a measure of the distribution of wealth between different wealth brackets within the country. So South Africa, this is from 2015, so it's at 0.620. So in Canada, you can see somewhere right about the middle, so it's at 0.313. Another challenge that a lot of my work, again, was, I guess, spurred on by is the unemployment rate in South Africa. So this is OECD data again from 2017. So South Africa is right at the right-hand side in red. So according to this data, it's 27.6% of the population is unemployed. So if you talk to people from South Africa or just look at other data sets, you'll see a much higher number. I don't think that this data includes people who are employed in the informal economy, which is quite a large percent of the total economy in South Africa. So the OECD total is about 6% unemployment, and Canada is right at 6.5 as of 2017. And one more slide to give a little context for the work and the country. So this is from Statistics South Africa, and it's a poverty head count based on 3 different indicators that they used. So the FPL, or the food poverty line, is the rand value, rand, R-A-N-D is their currency, rand value below which individuals are unable to purchase or consume enough food to supply them with the minimum per capita per day energy requirements for adequate health. So you can see in 2015, that was about 25% of the population. The other 2 indicators are the lower bound poverty line and upper bound poverty line. So the historical context for the project that I was working on, sorry, I had hit mute by accident. The historical context for the work that I was working on. So for those who don't know, in South Africa, there's something called the apartheid, started in 1948. It was the legalized racial segregation of different people based on ethnicity, ended in 1991. And that caused a lot of inequalities, especially a lot of spatial divides, and that is one of the reasons why the Gini coefficient for South Africa is so high today. So after the apartheid ended, there was 3 different economic plans or national development. The last one is called the National Development Plan, to try to reduce inequality, reduce poverty, and sort of spur the economy back on. So 1994, there was the Reconstruction and Development Plan. So that plan was all about meeting the basic needs for the population, developing human resources, building the economy back up after the apartheid, and making the society more democratic. Then in 1996, there was a new plan put in place. It's called GEAR, or Growth, Employment, and Redistribution. This was more of a neoliberal plan focused on privatizing the market. And then the plan that is very relevant to the work that I was doing is the NDP, or the National Development Plan. So that is the, from today until 2030, the framework, or the vision for South Africa. So the two overarching goals of the NDP is to eliminate income poverty and reduce inequality. And there's 13 different chapters in this plan. Each one sort of hits at a different aspect of how the country is going to achieve those two overarching goals. So I won't go through all of them, but number 11, building a capable and developmental state. This was the work that I was doing fit specifically under achieving or reaching those two overarching goals, reducing inequality and poverty through building a capable and developmental state. A good question would be, what is a developmental state? And if you ask different people, they'd say different things, but generally they have these four characteristics. And overall, a way to put it would be how the government interacts with society. So South Africa and the team that I was working with, and part of my project was to look at other countries that have gone through similar situations as South Africa and see how they were able to use certain interventions, how the government positioned themselves in relation to society and the private sector, and see if there's any lessons learned there. So the four characteristics were a capable and autonomous but embedded bureaucracy. So capable, meaning technically capable, autonomous, meaning autonomous from private interests, but embedded within the private sector, so bureaucrats having a relationship. Political leadership oriented towards development, a close, often mutually beneficial symbiotic relationship between state agencies and key capitalists, and successful policy interventions which promote growth. So the main research project that I was working on was to inform the 11th point in the NDP, building a capable and developmental state. And I was working on this project with a team of, so there's four of us, plus some 4 of us within the Department of Monitoring, Planning, and Evaluations, and then a lot of connection with the University of Johannesburg and a research center called ACE, the African Center for Evidence. And our project was to gather evidence on the different developmental states throughout history, so these different countries that have had these 4 characteristics, and then compile it all together, and the information would be used to sort of as a discussion point for how South Africa may or may not want to emulate some of these characteristics. So the purpose of the project was to understand what evidence exists on developmental states and build this evidence base so that people, when they're talking about it and when decisions need to be made about economic interventions, there was a solid base of evidence to draw from. And then the second purpose was to synthesize findings from different case studies of other countries and see which policy mixes they used and if those different policies were effective in furthering the developmental state. So an interesting point which I meant to say earlier was that in all cases, except for that of South Africa, developmental states are labeled after the fact. So an academic would look back on South Korea and say they look at their different economic policies, social interventions, and say, oh, this fits within the framework of a developmental state. South Africa, on the other hand, has the vision to become a developmental state, and it's labeled itself a developmental state, and they're trying to work towards becoming a developmental state, which is a bit interesting. And the purpose of this project then was to sort of understand what makes a developmental state, because it's easy to look back on what countries have done and say that it fits within a framework, but it's a bit harder to develop policies right now going into the future that will have the effect of increasing the GDP and reducing poverty and reducing inequality. So the workflow of the project was these 7 steps. Didn't go follow these steps 100%. First, developing a policy narrative. Second, determine what constitutes policy relevant evidence. Steps 3 and 4, these were the parts where I was actually in South Africa and working on the project. So it's a very long project. The time it's still going to be, as far as I know, the project is still going on, and it was started before I even arrived. So steps 1 and 2 had already been thought about and completed. My role was really in doing the searching, screening of evidence, some of the data extraction, and then steps 5, 6, and 7 are, some have been completed, some are still in the process of being completed. So specifically, my work was to do the search strategy for the gray literature. The searches and data extraction was already from the scientific literature, had already been completed. The team had used ProQuest, Web of Science, and EBSCO, and just done a search with the words developmental state. And then they used this general search to filter down and see which countries were spoken about within the literature, to then narrow down a list of countries to focus in on, or developmental states to focus in on, to do specific case studies on. So for the gray literature, we searched Google Scholar, did forward citation searches, targeted website searches, and then got information from content experts within the government. So the screening included, you can see in this chart here, there are 19 different countries, China, India, and South Korea, on and on. These countries were decided upon from that initial academic search and filtering down countries based on the frequency they were talked about as being a developmental state. We also filtered down screened based on the concept of the article. So developmental state, when you do searches for that, you also get a lot about embryology or animal development, so we had to screen those out. And then we were only looking for explicit descriptions of applied research methods, so no opinion pieces, books, advocacy pieces. So for the data extraction, the data, when I was part of the project, the data extraction had been done for the academic searches, and we didn't get to the data extraction for the gray literature. But what was extracted was, so importantly, the conditions that the country was in prior to becoming a developmental state and what policies it adopted to accelerate its growth and development. So the way, you probably can't read these, that's such small print, but the way in which the policy themes and categories were captured was by using the COFOG, which stands for the Classifications of Expenditure by Functions of Government. It's just a list of the different functions a government would have. And then there was some other categories that were added in after consultation with different sector experts. So some of the categories were the big headers: general public services, different defense policies, public order and safety policies, economic affairs. And then those get broken down further. Housing, health, recreations, culture, religion, education, social protection and cohesion. So hopefully from this you can get a sense of the scope of the project and the amount of information that was being collected. So the idea of a developmental state it cuts across every sector of an economy. So we were trying to pick out policies from each of these sectors. So here you can just see a flowchart of the amount of information that we searched for, screened, and then included. So the studies included from both the formal and gray literature search, there was 1,451. And then that last point, the last box on the bottom, studies included in the evidence map. So I'll touch on a bit later what the evidence map was. That is the goal of the project, to produce an evidence map. And there's 150 included to date. So once all that literature had been screened, data extracted from the academic literature, there were 3 different ways in which the evidence was synthesized. So the first, at the very beginning of the project, this was before I was there, the thought was that this could all be put in an evidence map. The team that I was working with had done one previously for the housing sector, so that is what they were working towards. So far, that the evidence map is still in progress, but this is a screenshot of what one would look like. So the idea is, on the y-axis, you have different policy interventions. On the x-axis, you have different outcomes, and the circles represent the amount of evidence that talk about an intervention and the outcome it may have. So these are helpful, and the department, the team I was working with, found that they're very helpful for thinking through theories of change. So how an intervention may have the impact or the intended impact. So the second way in which we synthesized the evidence was through different country case studies. So this also, the majority of these were completed before I arrived. So it's just a case study. I think each one was anywhere from 10 to 20 pages, going through all of those different COFOG categories and summarizing the different policies each country had that led it to become a developmental state. The third way in which we synthesized the evidence was through a rapid synthesis. So this part, I was present for this part, and this is what I mostly worked on. So we homed in specifically on the administrative services. We realized that there was just so much information to digest, all different sectors of the economy, health. It was quite hard to pick out specific policies, so focusing in on administrative services, we just looked at policies that fit under those categories, or that category, the administrative service category, to see how they led to the furthering of these developmental states. So the questions that we were asking were, what administrative services are used in the developmental states of, and we picked 5 countries, so South Africa, Rwanda, Botswana, China, South Korea, and Malaysia. And we asked the question, how are these services governed and managed, and then which of these services were effective? So we didn't, the third question, which of the services are effective? I have the questions here. Which of the services are effective? We didn't have enough depth of information to fully answer that, but we did answer the first 2 questions. And we put this together in a similar format to the rapid syntheses that the McMaster Health Forum does. So here are some of the high-level findings. So for example, in South Africa, we found that it has a strong democratic constitution, but the inherited power structure of apartheid limits the economic development. And for each of these 5 countries, we wrote up summaries of what types of administrative services they use, and if there was evidence on the effectiveness of these services, which there often wasn't, we would include that. So all 3 ways, before I go to the lessons learned, all 3 ways in which the evidence was synthesized, it was really driven by what people in the senior level of the department needed and what information they needed at the time. So the rapid response came about as there's 2 weeks, and then it actually became 4 weeks. The meeting was pushed back 2 weeks before a meeting, and we needed to have a document ready for a discussion at this meeting. So it wasn't possible to put together a full evidence map. The case studies had already been completed, but they're 10 to 20 pages long each, so maybe a bit long to digest for one meeting. So we decided maybe we can try to do a rapid synthesis on this topic. So from my trip, I think there's 5 big lessons that came through. So the first was that systematic research evidence and rapid response methodologies can be applied with certain modifications in sectors outside of healthcare. So coming from the McMaster Health Forum, I had mostly seen it done in healthcare. So it was nice to see very similar work on the topic of developmental state, which I would say is more economics, social policy. The second one is that evidence must be delivered in a timely manner to policymakers, so flexibility is required in the project workflow. And this just speaks to really me observing the team that I was working with and seeing how responsive they were to what different policymakers needed for certain meetings and the time frames that they needed it in. So as I said at the beginning, the overall goal of the project is to produce an evidence map, but that takes quite a long time, and in the meantime, these policymakers need other information. So there was a lot of flexibility in the project workflow. The third big lesson was that your research doesn't have to produce conclusive results. So at the end of this project, I don't think that I could say, or the whole team could say, what makes developmental states, what policies are effective in furthering the objectives of developmental states. We can more say that certain countries have this policy and then this is what happened. And that's okay. People and in meetings, policymakers expressed that they liked having this evidence in front of them and they could use this as a jump-off point for a discussion. And they didn't need to know what was effective and what was not effective. Because in South Africa, they have a different context, so it's just interesting to have a menu of options for which then they can discuss. The fourth lesson was that really came from me observing ACE, which is in the University of Johannesburg, the African Center for Evidence, work with my supervisor, who would be working in the public sector. And she was a real champion for evidence-informed decision-making. And I see I have an acronym spelling mistake there. And seeing how ACE really supported the team so that we could become self-sustainable. And I think that seeing some other, or hearing about stories of other consulting agencies that sort of leave you with a final report, and then you're not quite sure what to do with the report, and you have to then consult out again for the next report. I think that it's important from the outside, if you're an academic trying to work with people in government, to find those champions within government and really try to give them the tools to do it themselves, and then they can contact you. And the fifth lesson was that students can offer value to senior level teams. So I think when I first arrived, I mean, other than introduction to microeconomics, I'd never taken an economic course. I didn't have a background in any of this. So I really overestimated the importance of content knowledge. But I think people really appreciate a student's resourcefulness, and that can be just as valuable as knowing the content and showing that you're willing to learn it, and also you bring new ideas to the team. So that was my fifth lesson learned. That is a quick summary of my time in South Africa with the Department of Planning, Monitoring, and Evaluations. I think there's time for questions, so I can take any questions people would have.
Now that you've spent time in South Africa, what do you think is one thing that the Canadian system can learn from how South Africa does it? And what do you think is one thing that the South African system can learn from the way that Canada does it?
Yeah, that's a good question. I think the one thing that the Canadian system I'll talk about not the healthcare system specifically because I wasn't really working in that area in South Africa, but in general, I think the Canadian system could learn from the amount of reflection that South Africa and South Africans in general put into their work. So everything all the projects, at least that I saw in the department, were guided by sort of rectifying the past and working towards a better future. So maybe I'd say that was one thing that I would take back. And then going around the other way, I think that so a common thread that I heard and sometimes saw in South Africa and where I was working was that things are very siloed. I know that's a problem in Canada too. But I think that, for example, the effort that the forum is doing with social systems evidence, trying to break down some of those silos, the South African department I was working in could learn from that and try to reach across and break down some of their own silos.
So we do have a question that's been typed in online. So what surprised you most during your time in South Africa?
Well, I think the thing that surprised me most was that taxis honk at you when you're walking down the street, which they honk very aggressively, at least like 5 times as they drive up behind you, which really scared me the first few times. That really took me off guard. I thought everyone was going to crash into me every second of the day. People are always honking at you. I'd also say, so on a more serious note, the country is a very beautiful country, which I don't know if I wouldn't say it surprised me, but I didn't imagine the diversity in landscape that would be possible in such a geographically small country. So there's rainforests to deserts, mountain ranges to flat lands. It's a very beautiful country.
All right, excellent. Another question that's been typed in online, did the dynamic political environment in South Africa have any impact on your work? And if so, what was that impact?
No, so it didn't have any impact on my work. I think so. One way that I heard someone put it was that the politicians and people at the political level and in political office, if you're working with them, that does have a very large impact on your work. The team that I was working with, I would say would be like a mid-level bureaucratic team, so they've all been there for quite some time, and it's very stable at that level.
Excellent, thank you. I'll look at the room again and see if anybody has any questions. Nobody has any questions, it looks like. Again, anybody online, please type your question in the chat box. I'll ask another question while people are thinking, Malcolm, so somewhat of a leading question, and I apologize for it, but considering the work that you did while you were in South Africa, could you maybe describe how the Health Forum helped prepare you for that type of work that you did there?
So the forum definitely gave me the skill set to do research in a systematic way. So the content area was totally different. Didn't really understand any of it when I first started the project. But so the same steps that you would follow going through a rapid response working at the forum still apply in the area of developmental state. So doing a search for evidence, being comprehensive with your search, making sure you're screening and consulting with experts first to develop your screening tools, data extraction, summarizing it all, synthesizing it all, and then putting it in a way that is easy for policymakers to digest. So that basic skill set was very, very helpful.
Excellent, thank you. I'll give everybody one more chance to ask another question, and if not, I will advance to what will be our last slide, and just to thank everybody for joining us today, those of you who joined us online, those of you who joined me here in the room at the dialogue space at the McMaster Health Forum, and thank you especially to Malcolm for being our first presenter of the fall term. So thank you, Malcolm, for taking that big leap and being the first one. On the screen right now are a number of links that I'll just direct your attention to. The first one, if you're interested at all in our Queen Elizabeth Scholarship Program as offered through the McMaster Health Forum, that first link will give you all the information you need to know about it. The second link, if you're interested in our webinars, and we have a lot of webinars over the next couple of months, being complete schedule, including links to the webinars and how to access them are all on that second link. And then all of our Queen Elizabeth Scholars write a blog post about their experiences, and you can find them at that third link there about the MacHealthForumScholars.com. Otherwise, assuming there's no more questions, I want to thank everybody for joining us, and we'll see you all next time. There will be no webinar next week, but to compensate, we have 2 webinars in the first week of October. So thank you very much, everybody.